The war on transition. Heritage Foundation targets adult gender-affirming care. The Heritage Foundation has long been the powerhouse behind conservative policy, but their latest mandate, Restoring America's Promise, takes aim at a new target, adult transition. While much of the national headlines focused on bans for minors, the Heritage Foundation calls out for the federal government to stop funding gender-affirming care for adults through Medicare and Medicaid and to strip such coverage from federal employee health benefits. The agenda doesn't stop at the checkbook. It suggests that the Department of Health and Human Services should officially define sex as a fixed biological binary, effectively removing non-discrimination protections for transgender people of all ages by classifying transgender ideology alongside pornography. The plan seeks to push trans existence out of the public square and into the legal crosshairs. While appearing on the PBD podcast, Heritage Foundation President Kevin Roberts used the Rhode Island shooting as justification for going further, effectively outlawing transgender people. For the community, this is a wake-up call. Critics argue that by targeting the insurance and legal recognition of adults, these think tanks are attempting to make transition financially and legally impossible for everyone. It's no longer a debate about parental rights. It's a direct challenge to the bodily autonomy of grown queer Americans. As these proposals move forward, white papers to potential executive orders, the message is clear. The fight for our healthcare is just beginning. Well, there's so much to take away and unwrap from that. First of all, being a big supporter of trans rights, working for a production company with Dana Davis and Candace Kane, and knowing so many great trans people, and they're part of our alphabet and our community. The one thing that I keep on seeing is the hypocrisy. I did some research before reading this story, and apparently there's no attack on I can't talk today, but hormone therapy, surgery, medical procedures like breast reduction, augmentation for heterosexuals is acceptable and would be covered by those programs, whether it's Medicare or Medicaid. They might say someone needs to have a breast reduction due to physical components or other adjustments, but it's not okay for someone who is transitioning to have those things done so that they have better mental health and they are who they are. So again, the hypocrisy continues.
If you want to talk about hypocrisy, yes, it's the Heritage Foundation.